Good evening, and the topic for discussion today is related to the calcium, another important topic, helpful clinically also and in the exam also. So let us go through this sample report. So this is a report of a 65-year-old male. Focus over this value, calcium. Calcium being given under two headings. One is ionized calcium, which is given as 4.9 with an asterisk. Another one is the total calcium, which is mentioned as 9.3. So this is the topic that we are going to discuss today. Why calcium being given under two headings and which is more important, and as a doctor, which we commonly order for. So first, if we take calcium in the body, it is present in the bone, it is present inside the blood vessels, and it is in the circulation. If you take the calcium which is present in the circulation, it can be circulating in the two forms. One is bound to something, which is mostly albumin and other anions, which is bound to albumin and few other anions. Another one is the free form. Free means it is not bound or bind to any other molecule, and it is freely roaming around. So in the circulation, calcium is in two forms. One is bound form, another one is the free form. Okay. First, let us see what is this free form. Free calcium. It is the free calcium which is responsible for the physiological functions of the calcium. Free calcium, I can also say as ionized calcium. Is there any other name for this? Yes, you can say as non-bound calcium, or some textbook say as physiologically active form of calcium. Almost all denotes the same basic concept that it is not bound to any molecule and is freely in the circulation, and it is responsible for the physiological activity of the calcium. This is called as free calcium. And what are all the important physiological function of calcium? As you all know, related to the muscle, nerve conduction, clotting, and other regulation with the help of vitamin D, type PTH, that is intact parathyroid hormone, and vitamin D. It is involved in the homeostasis of this. Most importantly, this. So ionized calcium or free calcium or unbound calcium is responsible for this. So what is this total calcium? Total calcium include both free form and the bound. Bound form is the one which is bound to albumin and other anions. So total calcium include both these in the blood. So the sample is taken from the blood. If total calcium is mentioned, that means it includes both free form and the bound form. In many a lab report, only it won't be mentioned as total calcium or free calcium. Only it will be mentioned as calcium. That means it is total calcium only. They won't be mentioning specially regarding ionized calcium. And the normal level, 9 to 11 milligram deciliter. So this is the difference between the total calcium and the free calcium. So this is what it is mentioned. Ionized calcium is 4.9, total calcium is 9.3. The free form or ionized calcium normal range, there are age-wise normal range are there, but just you can remember as 4 to 5. So the total calcium you can remember as 9 to 11. So calcium, ionized calcium, I'm saying 4 to 5 approximately. Age-wise specific ranges are there, which varies in the range of decimals 4.4 to 5.5, 4.1 to 4.9, something like that, which varies from lab to lab also. Okay. I hope you got the difference between these two, ionized and the total calcium. Now, what are all the difference between this with respect to the clinical symptoms or clinical scenario? Total calcium is easy to measure, and the methods that we are using to measure the calcium, total calcium, is bit less costly. And this is the test commonly you used. We won't routinely order for a ionized calcium level from if unless the patient is having a specific symptom or specific things which are related to the calcium homeostasis. We usually get the total calcium. That is why most of the reports you will find only the total calcium report, which is in the range of 9 to 11. We, in most cases, in general evaluation and general checkup, in those situations also only we will be managing the case with the total calcium only because it is easy, less costly, and commonly used. Okay? And why free calcium is also mentioned in that report. Free calcium, these are the ionized calcium we used to order in situations where patient's albumin is very low, as in nephrotic syndrome. If we want to know the actual physiological level of calcium, and if the patient is having symptoms of hypocalcemia, hope you know the symptoms of hypocalcemia. If the patient is having the symptoms, but the total calcium value is normal, during that time this might be required. And in the evaluation of hyperparathyroidism or the disorders which are related to the calcium homeostasis, during that time to fetch the diagnosis, this might be required the calcium. And in CKD patient where the actual calcium patient might be hypocalcemic, if some symptoms, neurological symptoms are occurring, that time we want to differentiate it from a neurological condition or other cause of that particular neurological symptom, that time it might be helpful. What is the one concern? It's a bit costly compared to total calcium. The laboratory method to detect the ionized calcium, because we have to detect the ionized calcium separately. So that is why somewhat can say tedious process than the free total calcium, bit costlier, and we use in a specific situation where, as I mentioned, when the serum albumin is altered, when the patient is having some calcium related symptoms where we could not make the diagnosis, and in the evaluation of the syndromes related to calcium homeostasis or parathyroid disorders like pseudo hyperparathyroidism. In those, in the diagnostic evaluation, it might be helpful. Is it a problem if we do it routinely? Yes, there are labs which do it and give it in the sample report, even if we didn't ask for. In a normal or a routine patient where you're not concerned with the calcium, you are doing the reports as a part of routine evaluation, we might not require this ionized calcium. So this is all regarding the difference between the ionized calcium and the total calcium. So the summary is, most of the time clinically we use total calcium, easy to do in the laboratory method. No, the cost between these two, total calcium is somewhat lesser, and in the general checkup it is more than enough. And with respect to the ionized calcium, in the active form, physiologically active form, also called free calcium, not bound to the albumin. And this we will do under particular situations only. Any other question related to this I can regarding the normal values in the MCQ? They might give the ionized calcium, and if they give the value as 6, many students, if they are not knowing the normal value of the ionized calcium, they can't interpret and solve the MCQ. So with respect to that also, you should know the value of the ionized calcium. That's all. It is all about a small info regarding these two. We'll see in another good topic.